Welcome back. And as was mentioned earlier in the show, the focus of this segment is looking at Belize's plan for addressing Zika. Joining us for this conversation, we have Russell Manzanero, who's an epidemiologist at the Ministry of Health. We're joined by Kim Bautista, Chief of Operations at Vector Control for the Ministry of Health, and Carlos Ayala, International Health Services Advisor at PAHO WHO. Good morning and welcome.
Good morning. Good morning.
Now, gentlemen, Zika is a buzz all over the world, and it really has created, I think, a sense of fear for people who don't know a lot about the disease. So let's just start off by finding out what Zika is and how it's transmitted and what kind of symptoms people would experience.
Okay. Well, it is causing an alarm, as you mentioned, in various places. For us in the Americas, it's a concern because it's something new. We hadn't seen it before, but we knew about Zika from the early 1940s, when there was a study being conducted in Africa for yellow fever, and that was when there was a first isolated case of Zika virus in Uganda, right? In the Zika forest. So that's the reason why it's termed Zika. Later on in 2014, well, we started seeing that there were new cases in Asia, that we were seeing cases of Zika. And it was only until 2015 when we started hearing that in the Easter Island in Chile was the first reported case of Zika in the Americas. Pretty much then you heard about the big explosion, the big numbers in Brazil, where you started hearing many cases of Zika virus. It is a
It's less than 6 months ago that there was the first case in Chile, right?
It was.
So it's been a rapid spread throughout the region.
That's right. Pretty much because it's the same mosquito that has been causing dengue and chikungunya. So we're seeing that now as well. In Brazil, the alarm with when they were starting seeing the trends that there were an increase of incidence cases of microcephaly and other diseases. With those. And we also saw that at that time there was an increase of Zika virus infection. So that was the link that they were seeing. It's not definite.
And what is microcephaly?
It's usually when the babies are born with a smaller head. You're not sure if they have some brain damage, but it is probable. So what they're seeing there is that link. So that's the reason why there is such an alarm. As you mentioned, it's something that is being brought to our attention. World Health Organization has now termed it a public health emergency for the same reason. Though we want to say that Zika isn't as severe as dengue and chikungunya, it's something new to us, so we need to keep increase our surveillance with those.
That's one of the messages I know that has been coming out quite a bit, that Zika is not going to be the type of disease that will throw you down and out for a couple of weeks and really have you feeling very ill. It's a milder version even compared to dengue and chikungunya, right?
Yes, it is. With respect to the symptoms will generally last somewhere between 4 to 7 days. There is an incubation period from the time you are bitten by an infected Aedes mosquito. That period ranges anywhere from between 2 to 12 days. And a person would start developing those symptoms after that period of time. The symptoms generally last about 4 to 7 days. With respect to dengue, on the other hand, you're looking at about 5 to 10 days. If it's dengue hemorrhagic fever you're talking about, then it's more complicated, and then the body takes more time to recover because of the loss of platelets, etc. With respect to chikungunya, now for some persons or many persons, I would say, though you might pass through the episode within, let's say, 7 to 10 days, there is still that lingering effect in terms of severe arthritis pain, which could persist for several weeks to several months. So we wouldn't want to really say, well, which one is worse, but you need to look at other characteristics as well. For example, only 80% of persons who are infected with Zika actually present symptoms. So you're looking at a nightmare in terms of of detection and also for control. Because if you're looking at 80% being asymptomatic, meaning they're not showing symptoms, then we are normally guided in terms of responding to cases and things such as that. So if you look at it from that aspect, they all have their own weights in terms of which one is really considered the worst. You know?
And Carlos,
specifically for Zika, they're just the symptoms. What are we talking? Cold, like flu-like symptoms? What specifically should people look for
Well,
if they show symptoms?
Yeah, well, you're probably looking at the same symptoms that you're going to see for dengue and chikungunya, only that it's in a milder form. So you're going to see the rash. You're going to see an elevated body temperature, which is usually a mild fever. You're going to have headache, malaise, and what is characteristic and we're seeing and it's being reported is like a form of pink eye. It's not with secretion, it's just red. So whenever you see those, you tend to, okay, well, probably we're looking at Zika.
Okay.
now Carlos, what prompted the PAHO WHO to actually sound the alarm at this point? And is that a good or a bad thing? Because for some people, because it's without symptoms, what happens?
Well, the World Health Organization had a meeting and basically this Monday declared a global alert because mainly of the consequences in pregnant women that could have newborns with microcephaly, but also some neurological effects in some patients, because some patients have what is called Guillain-Barré syndrome, which is a problem that it's an autoimmune problem. So it's the effect, the secondary effect, how the body reacts to try to defend against this disease. But in that process, it generates antibodies that attack its own tissue. And most of the time, you have to put patients in intensive care because they tend to have problems even with breathing. It tends to pass, but the question is, microcephaly and Guillain-Barré have been increasing. We have seen, according to what has been reported, and it was already mentioned in Brazil, the number of cases, but in Central America, for example, official figures say that the number of cases of Guillain-Barré have increased as well. So they are very worried that it could be also quite linked to the
So there's
Zika.
a potential link at this point.
Yes.
And that's part of the terminology we hear all the time. People are not saying Zika causes women to have babies with microcephaly, and they're not saying that it causes the Guillain-Barré, but there has been a link or some kind of potential link established. What kind of research is now going in to be able to confirm that contracting the Zika virus causes these or can cause these things to take place?
Just to before answering your question, just to mention something about this global alert. As soon as WHO declares this alert, that helps getting more funds and also paying more attention to research, in this case to try to determine if there is a cause-effect, direct cause-effect of having the infection and having these consequences of the infection. And something that is already going on is, I know that there are some research studies going on in Europe. I know that in the States also the CDC and other institutions are doing some research. But something that also I would like to mention in relation to the global alert is that so far there have been some warnings in terms of traveling from areas, like countries that do not have the disease into areas that are already showing cases. And in that respect, WHO, PAHO, basically we are not saying you shouldn't, there is not a ban, but there are some elements that should be considered, mainly in women that are at childbearing age or are just starting their pregnancy. Not to say you shouldn't go, but you have to be very careful in terms of using all the preventative measures against mosquito bites.
What's the current link with the pregnant women and Zika? Is there a particular time in the pregnancy that women are more vulnerable to having or to eventually have children with microcephaly? Does it matter what trimester they're in, for example?
Well, this is what we're seeing in other places. It's still not a definite answer to Zika and pregnancy, but what they're seeing is that more than likely it's in the first trimester. The reason why is that during the first trimester, if you recall, is when all the neurological and the brain is developing. So that's probably where they're looking at. It's still a need for further investigation. We can't say it is that. It's just something that probably more than likely they need to do more studies. And like Dr. Ayala is mentioning, since the alarm has been set, there is funds now that will be channeled towards more investigations in this particular case.
Now, with the alarm from WHO, there has been kind of almost a pandemonium in terms of the response. Now, you have people talking about Zika being even sexually transmitted in the US. Is that?
Has there been any confirmation?
Confirmation. Is it confirmed? Is that a possibility? Does that add to the whole uncertainty around Zika?
Well, there is a fact is that it has been identified the virus in semen, but that doesn't necessarily mean that you can transmit the disease through that, through sexual intercourse. I know that it's in the media that the CDC has confirmed a case in Texas.
Yeah.
But we as WHO, PAHO, we cannot say that's the fact. That
It's
starting now, it's a problem of sexual, or Zika should be treated as a sexually transmitted disease. Because
as well.
Yeah, because that should be the consequence. But we are very careful because it's difficult to say that if that was the case, if it's true that that case happened, then there should be certain conditions under which transmission happen, basically, And that's part of the research. You have to be very careful in making that statement because many of the things have to also be part of the preventative measures.
And to be clear, that particular case was reported on Monday. 5 days later. So I'd imagine they're trying to figure out the how and what all the other questions that come along with it. But one of the things when I read that particular story was Zika is transmitted by mosquitoes, and the mosquito bites an infected person.
That's confirmed.
Bites an infected person and moves on to a non-infected person, and it's transmitted. So even close proximity to someone who has Zika can make you at risk.
Yeah, I think what we don't want to do is be too distracted away from the real impact that we as a public can have, and don't be distracted with the microcephaly, which is much less than a 1% probability, and even the sexually transmitted aspect or potentially sexually transmitted aspect, which is even far less, and to really look at what is really what we're really facing, which is basically a disease, a mosquito that could transmit both dengue, chikungunya, and now Zika. And so there are things that we could do and that we have confirmed works. And so we don't want to be too distracted as to the other stuff, and I think we should be more focused.
So Victor, what you're advocating is that what we really need to focus on is vector control.
Yes. Yes.
And sometimes that gets lost in the frenzy of everything else, because we already see in news coming out of the US, for example, that in Florida they have, significant warnings and cancellations and all kinds of stuff happening because people are uncertain about Zika itself. But how do you get back to the salient message of actually talking about the eradication of vector breeding areas, and vectors in general?
To what Dr. Ayala said, one of the added benefits of WHO declaring an emergency, one of the benefits is that it basically gives us the opportunity now to highlight what we've been trying to hammer home for many years, that we're dealing with a particular mosquito, and this is how you prevent getting bitten by the mosquito. This is how you prevent the mosquito from growing. And so if you do these things, you're basically preventing dengue, which is a threat within the region that is getting worse every year. You're preventing chikungunya, which we still haven't really understood the impact and even the distribution of chikungunya in the region. And now you're looking at Zika. So there are certain key messages that we need to look at, and so by the declaration of that emergency now, it brings back vector control to the forefront, looking at what we could do, looking at water holding containers in our premises, looking at the issue of drainage, proper housing, the use of insect repellent, screening of homes, things that we could do.
I mean, we have seen public health messages on these very same issues for a very long time, and you're quite right. We've seen, I believe in 2015, 679 cases of dengue, and it has been around that range for the past couple of years, and those are only the ones that we have confirmed tests on. So you seem to be taking your message back to just a basic prevention methodology. No get bite.
Exactly.
Avoid getting bitten by mosquitoes. And it seems simple, but it really is how you would get dengue, chikungunya, or even what's most feared at this time, Zika. Now, how do you take this message that, quite frankly, you've been saying in other words for a long time, and really try to drive it home now, especially since people are so fearful of Zika?
And fear usually paralyzes instead of get people to actually act. Or does it?
Yeah, I think the whole nugget bite slogan, basically, one of the things that we also want to add is that there's a shared responsibility by the public. I think Belizeans have become so complacent. We've been seeing dengue since the early 70s, and it's gotten worse over the years because of the different serotypes that have circulated. But we have been fortunate that we haven't had the deaths that we see in neighboring countries, so we become complacent. And now with probably it's a good thing that they're highlighting the other potential impacts of Zika, such as the microcephaly and other complications, because probably now we could use that opportunity to highlight the importance of them taking that shared responsibility and not relying on vector control coming to literally help you clean your yard, or literally turn over empty bottles or containers, or cover your drums for you, you know. There needs to be that onus on the householder to do their part and not relying on vector control to come around and spray, which basically just buys time.
Yeah. And then let's get to one of the fundamental questions. We have not reported at this point any confirmed case of Zika. And my question to you is, from your knowledge of how vector-borne illnesses work, from your knowledge of the symptoms and signs of Zika and how it manifests when somebody is infected, do you think that we do not have cases in Belize at this point?
That's highly unlikely. We are expecting to have cases of Zika. If it's already here. I believe
it's a fair assumption that it's in the country.
When I came and we spoke, we were talking about dengue and chikungunya, but as I mentioned, Zika is here. If you saw the map, it's showing that all our neighboring countries and the islands are already with cases of Zika. So we haven't had confirmed cases.
Which means it hasn't been sent to the lab, and the lab says it is Zika that you have.
We've had suspected cases.
Okay.
And those have been sent to CARFA. That is where in Trinidad where we do send our testing. So we are awaiting some results. So even though it comes back positive, the measures that you take is basically the same as what Mr. Bautista is saying, that we don't want to reinvent the wheel. It's going to be here, and we need to do something about it, but it's basically the responsibility of the community. Town councils need to get involved, schools, campaigns, cleanup. So all of that is important. we are taking our measures at the ministry in seeing how we're going to work along with all the units to see how we're going to get this on board, but it's basically the same thing that we have been doing in the past. So to answer that, then yes, I do believe it's here. It's just that we don't have it confirmed from CARFA.
Yeah.
And we are actually working along with PAHO as well to see where we can actually get more testing done elsewhere other than CARFA, so that we can get a rapid response, a turnaround time to those confirmed cases.
Now, because you're talking about this as a concern for all of the Americas, obviously, how are we tying into regional initiatives to actually make sure that we're doing the same things across the board?
Right now, PAHO has been having a series of seminars to try to standardize certain definitions. For example, what Kim was mentioning about the difference, clinically speaking, how to diagnose or how to suspect that it couldn't be maybe a mild case of chikungunya or something like that. So that has been happening since 2 weeks ago. And we have been having these seminars regularly with Ministry of Health officers, mainly because Ministries of Health had to fine-tune at the end their protocols, the current protocols, to standardize processes. Otherwise, there could be situations in which you are going to report more or under-report cases.
Yeah.
That's the first thing. The second thing is that CLAP, our regional center for the Americas that deals with pregnancies and neonates, which is based in Uruguay, they have been also improving in terms of providing information, technical information for Ministries of Health, for Ministry of Health to adapt those to the clinical setting. And in that respect, there are basically, as Kim was saying, the same kind of messages that we have been passing for dengue and chikungunya. But one important thing is to attend the checkups, the clinical checkups. So it's not because of this situation that you have to run to the health service. So if you regularly go to your medical examinations as a pregnant woman, then the likelihood of maybe detecting a problem, it's higher. Not necessarily Zika, but any other problem, and that will help.
Now, the campaign of No Get Bite is a blanket statement, and I think is important because men will be protecting themselves, women will be protecting themselves, families will be protecting their children. However, we've seen, because of the potential link with the microcephaly, where pregnant women are giving birth to, pregnant women who've been infected with Zika are giving birth to babies with smaller heads. We've seen in other countries where there is a specific warning to women to not get pregnant for a period of time. Is that something that is going to come out of the Ministry of Health at this time? And what, if so, or if not, what will be the message to pregnant women, or to women who are thinking of getting pregnant?
Basically, we are not going to have that implemented. We're going to advise pregnant women to not get pregnant.
Women to not get
or
pregnant.
to use contraceptive. No. We're looking probably at the same messages that we're going to do, that everyone is at risk, not only the pregnant women. And if you are, then still you need to take the measures that you're going to do to protect yourself. Your adequate use of clothing, insect repellent. If you're pregnant and you're in an area that has a lot of mosquitoes, the use of bed nets. So we are not looking at that. It's something that there's pros and cons of that message as well. But we as a ministry, we're not looking at that. So it's something that we are working more with vector control, that these messages need to go out because everyone is at risk, not only the pregnant women.
So what is the ministry doing in terms of increasing not only surveillance, but efforts to get people to participate, and in general in terms of the whole vector control and just the awareness without creating kind of a frenzy, you know, because obviously with it becoming a part of the American media, you're going to have a lot more stories being bombarded with people and uncertainties and fear and everything. How do we keep our message local but regional but realistic to where people can really impact?
I think one of the things that we must highlight, and probably it's on the fault of the ministry for not always putting out all the things that are occurring in the background, but over the past weeks we have been working collectively as a group, Vector Control, MCH, the epidemiology unit, and what we have, and the lab, and what we have done is develop a national preparedness and response plan. But further to that, we have...
So Zika or vector-borne?
For Zika,
okay,
that's
for Zika.
specifically for Zika. We have also made contact, and sometimes, and in some situations, we have been approached, for example, by the Red Cross. We have also received message for a request from the Ministry of Education to take the message to the classrooms. We've also gotten the assurance from the government that whatever inputs we need to seek that out. So I think that one of the things that is causing the alarm is that if you look at right now, for most countries in the region, it's a dry period. We've just passed through the rainy season for most of the region, and you're still having transmission all over. And so if you're looking at transmission now, when it's supposed to be the low season, so to speak, imagine when we move on into the rainy season in the region, it's going to explode. And so we take this opportunity now to piggyback on the messages that we've been sending out all along in terms of cleaning up your eyes and preventing the bites. So, yeah.
Kim, we have seen on a year-to-year basis that there are hotspots that tend to have higher number of cases of dengue and chikungunya. Is there now a specific effort to be able to target these areas in prevention of Zika?
Yeah, fortunately, it's the same mosquito you're dealing with, and we have data for many years. And so what we have done is, over the years, we've been able to identify right down to even neighborhoods and streets that are a problem throughout the country. Yeah. And so what the message that we're now sending out, and it's part of our internal preparedness and response plan to the regions, who basically are responsible for the execution, that look, you guys have the data, you know the neighborhoods, you know the blocks within the city, you know the villages. It's time now to go back and start doing some groundwork and ensure that, one, you're doing your education in these communities, and two, that you're taking some preventative measures in terms of spraying, if it's a distribution of bed nets, if it's larviciding, you already have the data, so now it's time for them to go back. I think what we need to do in terms of the message is to start using the local media within the districts to highlight some of these areas so that the public knows which areas we're talking about.
Now, we know that the fogging is taking place. We see that schedule, I don't know if it's been increased, but we see it's taking place. You spoke about encouraging people to clean up their own neighborhoods. But there are some areas that are just generally susceptible to poor drainage and tend to have more stagnant water and breeding grounds for mosquitoes in their own areas through no fault of theirs. What is being done to address these areas? Do you have links with other ministries who will be assisting you? And will you be tackling those as well?
Yeah, with the whole Zika issue now, we're looking at the aspect of working with other ministries in terms of cleanup campaigns, and not only other ministries, but the municipalities. So we're looking at the cleanup campaigns as a big aspect, but there are some hotspots where we've moved into planning for things such as the distribution of insect repellent and also bed nets. That was started when you had the recent flooding in Belize. We had linked up with PAHO and even Grace Kennedy, and we had distributed packages with bed nets, insect repellent, mosquito coils to areas. I think we did Gongolong in Belize City and some area in Southside. Over the past months, we've also targeted some areas such as San Mateo, San Juan, and those areas in San Pedro. And so we kind of look at some of these risk factors, poor housing, poor drainage, things like that, and to see at least if we, you cannot, it's not practical to be constantly putting out insecticide and spraying, so we need to see how we prevent the human vector contact. So if we could give out bed nets, or we could do some residual spraying in the house, if we could give out some coils and repellents, we should have an impact in some of those little hotspots, which could, if you have the introduction of the virus within that community, it could just explode because there's a proliferation of mosquitoes there rally around.
All right. Yeah. So what is, I mean, part of what has been taking place, and as we mentioned, there is a frenzy in other parts of the world. So that allows people to look in our own country and say, well, we're not doing anything, or we're not doing enough. So what is your message to the public about what Belize is doing to be able to ensure that we can have the best control over the situation?
Yeah, well, as a whole, the public can be assured that we, as in the ministry, we're looking at, Mr. Bautista is saying, we're increasing our surveillance. When you talk about surveillance, you're talking about what we are doing as an epidemiology unit, as a vector control unit, public health, the communication that is being done. So it's basically to sensitize and get the knowledge of what it is to be a vector-borne infection. Not only want to focus on Zika, but we want to focus on dengue, chikungunya, and Zika now. But as well, we need to, the community has to put their part. The responsibility in the end actually falls on you. So you need to actually have your area clean. So that's the message you want to get out, that even though it's here, it's not confirmed, but similarly we need to treat it like we did with all the other ones as well. So it basically boils down to what we're going to do and the messages we're bringing across.
One final question for me before we wrap. So because all three diseases are transmitted by the same vector, and I guess for some people that would be a concern, can you contract possibly all three within a relatively short period of time? Or
for Zika, it hasn't been documented as yet, but for dengue and chikungunya or chikungunya, it was documented. I could recall last year with the transmission of chikungunya, there were certain places, the Dominican Republic was one, where there was a high co-infection rate, meaning that you have persons with both dengue and chikungunya. Not necessarily meaning that the mosquito had both viruses, but they were just exposed to the two diseases. And so if you look at the likelihood now, the same mosquito being capable of transmitting these three diseases, the likelihood of getting one of them throughout the rainy season or throughout the year basically just increased for us.
Right. And the very simple messages, like you said before, nugget bite.
Shared responsibility.
All right. Wear your repellent.
Yes.
Get rid of the breeding grounds. Wear a long sleeve if you must be outside, or proper clothing. And also avoid the high mosquito times, which is early morning and dusk.
You guys got it.
And even go
I've
back
been
to
reading your flyer.
spraying out your house.
Spraying, yeah. And especially women who are pregnant. So.
All right. Well, thank you, gentlemen, for joining us this morning.
All right.
We're going to go ahead and take a break, and when we return, it will be to focus on the National Spelling Bee 2016. Don't go anywhere. Open your eyes continues after these messages.